people will join it. But I guess that's my cue to get started. Welcome everybody to the monthly MIDAS webinar. I'm Harry Hockheiser, the director of the MIDAS Coordination Center. Today we have what I think will be a very nice talk by Dr. Talia Quandelacy. Dr. Quandelacy is an infectious disease epidemiologist and assistant professor at the Colorado School of Public Health's Department of Epidemiology. She does a lot of work on transmission dynamics of respiratory and arboviral diseases and quantifying disease patterns across space and time to inform preparedness and prevention efforts. She is part of the Colorado School of Public Health's COVID-19 modeling team and was previously a member of the CDC COVID responses modeling and forecast team. She did her postdoctoral work at the CDC's Dengue branch in Puerto Rico, working with Michael Johansson, who many people in MIDAS will be familiar with. And she completed her doctoral training in epidemiology at Johns Hopkins Bloomberg School of Public Health. I'll also point out that she's an accomplished artist and some really great carvings on her website. I encourage everybody to take a look. Dr. Quandelacy, thank you for joining us. We're looking forward to your talk.
Great, thank you for having me. I'm excited to talk a bit about some of the work that I've done for my postdoc on seasonality of dengue and looking at how we can forecast dengue across the Americas, and really talking about how we can use dengue surveillance data to identify disease patterns across the region. So for people who aren't familiar with dengue, it's a mosquito-borne disease caused by dengue virus. It's transmitted by Aedes species mosquitoes. The figure on the right is showing Aedes aegypti, one of the main transmitters of dengue. And there are 4 serotypes of dengue virus. In terms of its geographical distribution, a number of countries are categorized as having frequent risk, and most of those are countries within Southeast Asia, some countries within the Middle East and East Africa. But as you can see in this figure, a substantial portion of the Americas is also considered to have frequent risk of dengue. And in a modeling study, there was an estimated 96 million infections per year among those at risk in 128 countries, so kind of highlighting that a number of people are at risk for dengue and do experience substantial morbidity and mortality from this disease. In thinking about how dengue is transmitted, it's transmitted when an uninfected mosquito bites an infected individual. That mosquito then becomes infected with dengue that bites a healthy individual, and within 3 to 14 days, that individual begins to develop symptoms. In terms of the disease spectrum of dengue, a substantial proportion of infections are asymptomatic, anywhere from 80% or higher can be an asymptomatic infection. And a smaller proportion of individuals do experience symptomatic dengue. And that's typically comprised of a range of symptoms going from fever, headache and rash, or joint and bone pain. Oftentimes upon secondary infection, individuals experience severe dengue, which can be comprised of shock, severe bleeding, and some stomach pains and vomiting. So I'm going to try to move the window. Bear with me 1 second. The window is blocking my severe vomiting and stomach pain. Sorry. So most of what I'm going to talk about in this first bit of my talk is on dengue seasonality. And in thinking about seasonality, it's important to talk about potential drivers contributing to dengue transmission dynamics. And so this figure here is just showing the time series of dengue from Puerto Rico. And you can see that there are kind of peaks that seem to happen from one year to the other, but also you have really large peaks showing kind of epidemics that tend to happen at least every 3 to 4 years. And so thinking about what some of the potential drivers are of those transmission dynamics, those can include vector aspects of the vector. So thinking about the life cycle of the mosquito, or things like vector abundance, which we won't talk a lot about in this talk, but is important. Climatic factors, so changes in rainfall, temperature, or kind of events that happen every few years, like El Nino Southern Oscillation. Viral evolution and serotype prevalence, so aspects of immunity or underlying changes in the pathogen that impact transmission dynamics. And again, we won't mention that here, but important to remember. And lastly, human and sociological factors. So thinking about how changes in the population or demography, like birth rates and mortality rates, can impact transmission dynamics, or things like changes in urbanicity or even human movement, and how that can drive some of these dynamics that we see. So in thinking about seasonal dengue dynamics, we're really talking about the patterns that we see within the year. This figure on the left is just showing kind of the seasonal dengue distribution for a number of different countries in Asia and Southeast Asia, and showing that dengue tends to peak in these regions in the months between May and August. But though you can see there's some variability depending on which country we're looking at and when those peaks actually happen. Similarly, there's seasonal patterns that we observe in states across Brazil, where we see that in regions or states like Acre, we have peaks happening in the earlier part of the year, so from January to March. But as we move across the region, we can see there's a shift in some of the timing of these peaks, where they can occur anywhere between May and June in a place like Alagoas. And some of the factors that contribute to seasonal dengue dynamics can be things like seasonal migration of individuals from different locations, or also climatic variation. So when we're thinking about seasonality and how temperature can change within a year, but also considering how rainfall changes throughout the year as well. In addition to seasonal dynamics, there's also multi-year dengue dynamics. So as I've mentioned before, thinking kind of about these multi-year cycles, or these really large epidemics that we tend to see not on a year-to-year basis, but kind of every 3 to 5 years. And that's kind of shown in this figure here, where the arrows are pointing, showing these large epidemics that tend to happen on a slightly different time scale than these seasonal epidemics. And there's some evidence from studies that show that El Nino and different temperature changes can impact the occurrence of these large epidemics, and with some of the evidence coming mostly from Southeast Asia, though there's been analyses that support this for Mexico and Puerto Rico. So given that a lot of the research that's looked at kind of regional dynamics for dengue has focused on Southeast Asia, one of the questions that I had, or that we had, was just what are the regional dynamics of dengue in the Americas region, especially considering from that map, the wide geographical scale that's where dengue poses frequent risk. And so within that, some of the sub-questions we're also interested in looking at are what are the seasonal patterns across the region? What do kind of the multi-year long-term patterns also look like? Are there large epidemics that happen across the region, or is it just kind of a lot more heterogeneous? And if we see both seasonal and multi-year patterns occurring, can we identify potential drivers that might explain these dynamics? So to answer this, we aim to collect dengue surveillance data, historical data specifically. Most countries actually started to collect routine dengue cases starting in the early 2000s. So there are a few countries that had dengue surveillance systems in place since the mid 1980s. Those are Mexico, Puerto Rico, Brazil, and a couple others. And much of this data is collected at either the weekly or monthly level. And so we can find, these time series of symptomatic dengue cases kind of dating far back as the surveillance system started, and seeing if we could find this data available at the national and subnational level. And so we partnered with a number of governmental and academic collaborators to collect this surveillance data And just some considerations of using dengue surveillance data are that, these data are susceptible to variations in reporting rates and case ascertainment. And that's particularly, something to consider, especially around 2016 with the Zika outbreak happening across the region, but also that these are aggregated total counts of dengue. So we didn't have any age-specific or serotype data available to us. And so this figure here is just showing you what some of the data actually looks like. So we were able to collect historical dengue surveillance data from 14 countries. And so we collected much of this data at the subnational level. So we have monthly dengue surveillance data from 239 locations, roughly spanning the time frame of 1985 to 2019, though you can see in this figure, the x-axis is time, and there's quite a bit of variation in the data available from a number of these countries. But so this figure is showing the normalized incidence of dengue for each location. And these locations are grouped by their country and ordered from northern to southern latitude. And so blue signifies periods of low dengue incidence, and red indicates periods of high dengue incidence. And really, this figure is showing at least that even just looking at normalized incidence data, you can see that there are some kind of patterns of red that you see every year across some of these countries, but also there's some evidence that there might be banding across the entire region over certain periods. And so with this time series data, we wanted to look at what these seasonal patterns look like and what these multi-year cyclical patterns also look like. And so we did this using some wavelet methods. And so what we did is we processed this data by taking the original dengue time series, which is this top plot here, normalizing it, and normalizing it to be able to compare across different countries, given there's a lot of variation in magnitude of dengue incidence across these locations. And then using the wavelet methods, we isolated the average seasonal patterns, and we kind of considered a broad window of seasonality to be ranging from 8 months to 16 months. But you can see the seasonal pattern for this particular time series, which is the blue overlaid on top of this gray time series. And you can see the peaks and troughs within each year. In addition, we were interested in looking at the multi-year cycles. And so we considered kind of a multi-year cycle to be a window from 24 to 60 months, ranging roughly from 2 to 5 years. And that's the time series line that you see below in the red. So comparing it to the original time series, it's not so much capturing kind of the annual peaks and lows of dengue cases, but really some of these larger epidemics that you see in this original time series, and those peaks in the red corresponding to those peaks in the original time series. So this figure here is showing what those seasonal patterns look like across the region and over time. So as you'll notice, there's a fairly strong seasonality within all of these countries, and even fairly synchronized kind of within sub-regional sections. So the lines are showing each individual location, and the colors are plotting the seasonal wavelet coefficient. So red indicating kind of the seasonal peaks of dengue, and the blue, the seasonal troughs or the lows. And this really shows, that there is a strong seasonal pattern across the region, though, as you move from Mexico down to Brazil and Argentina, you can see that the shifting of this timing tends to vary quite a bit. So given, that one of the questions we're interested in is, when do these peaks actually happen? What we did is then we took this average season with the seasonal pattern, and we aim to kind of estimate what the average seasonal pattern looks like within a year. So, when on average does the peak tend to happen, and what particular month does that tend to correspond to? So we did this analysis for all of the locations and then plotted it on this map here. So the gray coloring is just showing locations or countries that weren't included in this particular analysis, but the coloring then shows the months that dengue is peaking for different locations. And what really stands out here is that you can see this noticeable shift in the timing, showing that in the Southern Hemisphere, we tend to see dengue peaking in months between January and May. And then as you move past to the equator, which makes sense in terms of the change in climate and kind of seasonality that we might expect, we see the shift moving into kind of the June to September months that we see dengue peaks occurring in Northern hemispheres. We also did a similar analysis looking at the timing of temperature peaks and also did a phase analysis comparing kind of the lags between seasonal dengue and temperature, and found that both consistently estimated that dengue tends to lag by 2 to 3 months, or dengue peaks tend to lag roughly 2 to 3 months after temperature peaks, which also corresponds with kind of the relationship that we've seen between temperature and the vector life cycle with dengue. So I've mentioned we wanted to look at what this average seasonal pattern looks like. So that's what this figure is showing here. So each panel is a different country, and then each line is a location, a subnational location for each of those countries, and showing the average pattern for that particular location. The y-axis is just the seasonal wavelet coefficient, and the x-axis just shows each of the calendar months. So you can see within a number of countries, there's fairly similar patterns and timing of their seasonal peaks and lows. So clearly some heterogeneity observed, particularly with Colombia and Venezuela. Some of that might be attributed to kind of the geographic heterogeneity within those countries. But you can also see that as you move from Mexico down to Argentina, you also see again this shift in the timing of when dengue peaks and when dengue, at least seasonally, is low. Not only were we interested in characterizing the seasonal trends of dengue, but we were also interested in looking at what some of these multi-year cycles look like. And given that the time frame for each country really varied, we didn't have data from 1985 to 2019 for all countries. It varied quite a bit. So we restricted our multi-year analysis to look at only countries that had at least 10 years of data or more. So once we did that, we were able to evaluate kind of the multi-year trends for roughly 8 countries. And this is the figure here. And so what we see is that at least within some regions of Mexico in 1997 or 2001, we see that there's some kind of local bandings occurring within the country. But what we also see is that, at least for data that's available to us, we do see some banding regionally in 2006 to 2008, though some of the timing of this pattern seems to be scattered across the region. But we see some clearer kind of banding showing wide regional epidemics occurring roughly between 2009 and 2011. We haven't really dug too deeply, though we're looking into this now, about what might be causing that wide epidemic, but some ideas might be that it's a serotype introduction, but also potentially corresponding with maybe an El Nino event. So in summary, from our analysis of kind of these disease trends across the region, we found that there is fairly strong seasonality within each of the countries in the region, that these seasonal dengue peaks shift from kind of the earlier months of the year in the Southern Hemisphere to later around June to September in the Northern Hemisphere, that these dengue peaks really tend to lag 2 to 3 months following seasonal temperature peaks. and that, we see that there's some evidence of multi-year epidemics occurring at the regional level. Kind of the most obvious pattern seems to be from 2009 to 2011, though really we're kind of limited in seeing more just given the length of the time series data available to us. But I think that gives us some nice evidence that there is some really interesting kind of synchrony and interesting multi-year dynamics occurring across the region. And so based on some of those analyses, we were hoping to use some of this information to inform how we can build forecasts to forecasting models to look at dengue across the Americas. And really the reason why we want to do this is really because, given there aren't any pharmaceutical interventions, we really rely on prevention measures to prevent dengue infections. And thinking about, forecasting dengue epidemics, we're really doing this to be able to or implementing early vector control before these kind of peaks really start to occur. And also thinking about secondary prevention measures. So things like hospital staffing and capacity preparation for the number of beds that might be needed in the event that there are, dengue outbreaks that start to happen. And so from our seasonality analysis, what we really took from this was that, we saw strong seasonal patterns across the region, but the timing did vary geographically, and that we saw these kind of region-wide epidemics. So are there certain indicators that we can look at that can help us to predict these or forecast these better? And so some of the questions that we were interested in are, what indicators work well to forecast dengue across the region? And not just thinking about developing forecast models, but can these forecasts tell us something about, potential drivers of these dengue dynamics? And then another was thinking about, if we forecast dengue, what is the forecasting skill? Does it vary across different countries, or are there certain factors that really influence the ability of models to forecast dengue well? So what we did was we aimed to forecast monthly logged dengue cases. We used all of the data available to us, so roughly 244 locations across 14 countries. And given, as I've mentioned before, the heterogeneity of these data sets in terms of the time frame available, what we did was we cut the data in half kind of based on time. So we wanted to be able to compare our forecast over a similar time frame across all of the countries. And given that there is such variation in the timing of this data available, we looked for the period where we had at least 1 year of overlapping data. And that really happened to be just between 2010 to 2012. So we used 2011 as kind of the cutoff data. So we used any data prior to that time frame, no matter the length of data available, as our historical training data sets. And then we used the data after 2011 as our testing data. So with our training data, we built roughly 13 to 14 linear regression models to train for our predictions. And we did out of sample validation using the testing data, where we forecast cases for one individual month and forecast forward in time at least 1 month ahead up to 6 months ahead, and iteratively predicting forward in time until we ran out of testing data. So we ran roughly 14 prediction models for all 244 locations in our data set. And in thinking about which predictors to use, we considered using indicators of dengue itself. So we developed a reference model that looked at just the average the past average cases, so kind of an intercept model. We also looked at dengue cases from the month before, which is the time series here in the what we're calling our AR1 model. And not only are we thinking about indicators at the local level, but also what do dengue patterns regionally tell us in terms of being able to predict dengue locally. So we created this variable that we're calling a lagged weighted regional time series, which is really an average time series across all of the locations in our data set and weighted by the population of those locations. And so that's what this time series looks like at the very bottom left. We also looked at seasonal indicators, so just a calendar month variable ranging from 1 to 12, but those tend to capture some of the seasonal variations a little bit better than other indicators that we might consider, like the climate variables. And of course, we evaluated climate indicators. So we looked at the average monthly temperature lagged by 2 months. We looked at the total rainfall for all locations, and also looked at the multivariate ENSO index lagged by 6 months, and evaluated those individually. And then we also evaluated all of these predictors in some combination. And so to evaluate these forecasts, we used what's called a log score metric. So it's a measure of forecasting skill. We bounded it to range from -infinity to 0, where an estimate closer to 0 is signifying better forecasting skill. And we estimated a log score for each time point prediction, and did this by using a probability estimate that we generated by incorporating the observed cases, the forecasted cases for a particular month, and the standard error from that forecast. So what we did to evaluate these forecasts was we used the log score to look at, how does the forecasting skill change across horizon times for different models, and really thinking about which models work better or forecast better across the region. So thinking mostly at the regional level and the national level. And I'm not going to talk too much about the month-to-month forecast that we did, but just to give you an example or an idea of what some of these results look like. This is some of the dengue forecasts from using an AR1 model. So just using a model that incorporates dengue cases from the previous month, and doing forecasts for 1 month ahead and 6 months ahead. So as you can see on the left figure, this is showing the forecast in this kind of green line, and the observed cases is the black line, and showing that at least with 1 month ahead forecasts, they do fairly well in capturing the general pattern and magnitude of the observed dengue cases, but clearly are kind of shifted in time in terms of when the actual peaks and lows are happening. But this model tends to perform much worse when we're looking at a 6 month ahead model, showing that these predictions really don't capture much of the observed pattern or the magnitude. And you can see that as well through the wide intervals from the predictions. Just to show another example, this is from Amazonas and Venezuela, which is showing predictions from an AR1 seasonality and El Nino model. So showing the 1 month ahead predictions still capturing some of the magnitude of the peaks and the lows, but again, the timing still a bit off, and with 6 months ahead, capturing some of the general pattern, but again, missing in magnitude, and really showing kind of the challenge of trying to identify what models work best when we're looking only at the time or the monthly predictions. And so because of that, and also because these we generated roughly 1.2 million monthly predictions, we aim to look at kind of the aggregated log scores at the regional and country level. So this figure here is showing the average log score when we average all of the prediction log scores up to the kind of regional level. So each dot is showing the performance of an individual model at different horizon times. So the horizon times are in the y-axis, showing 1 month ahead to 6 month ahead forecasts. And you can see for all of the models, generally forecasting skill declines as we try to predict farther ahead in time. And you can see that each of these lines shows kind of the general trajectory, and you see kind of a clustering of different sets of models, some starting worse and getting worser, for lack of a better phrasing. And some of these models clustered kind of at the top, showing better performance in earlier forecasts, but also declining as we move forward in time. But one model that consistently had better forecasting skill was the AR1 seasonal factor model, and showing that this had improved forecasting skill compared to other models, even at 6 months ahead. So we can look at just the general change in forecasting skill over time, but we can also look at kind of individual model performance. So this figure here is showing the average model score for each of the models that we looked at. The black dot is showing our reference model, which was an intercept model, and the dotted line is just referring to its average log score estimate at 1 month ahead. And you can see that for some of these individual predictors, they kind of have the similar forecasting skill to our base model, though an AR1 model seems to perform fairly well. And then that some combination of these indicators tend to have improved forecasting skill. And we can see again that the AR1 model seems to be among those that have better forecasting skill. And we see this consistently as we move across lead times. So even as we move to 6 months ahead, we see that some models actually perform worse than our reference model. That particular one is our El Nino only model, though we still see that an AR1 seasonal model, which is this red dot here, still kind of is consistently one of the better performing models, even at 6 months ahead time. And thinking about what some of the factors might be that explain this variation in forecasting skill, we wanted to look at generalized linear models to help us identify what some of these characteristics are that might be driving forecasting skills. So we evaluated some factors like the horizon time, the country itself, the length of modeling data available given kind of the wide range of time series data available for model building. And in case there were any effects from population, we evaluated population size. And I won't really go too much into this analysis, except to say that we found that length of training data did seem to matter. So the more data available, kind of the better the forecasting skill of the model, the better the forecasting skill of the model, that there was quite a bit of heterogeneity in forecasting skill by country. And again, as we saw in some of the earlier plots, that forecasting skill declined as we were trying to forecast farther ahead in time. But we can at least account for the effects of some of these factors to at least evaluate which model performs better after accounting for these factors. And this is showing the country level forecast, at least for 1 month ahead. The figure here now is showing surprisal, so a related estimate of forecasting skill, where the higher the surprisal, the worse the forecasting skill. So you're kind of looking for a lower estimate for improved forecasting. And showing that at least at 1 month ahead, the individual forecasting models still performing similarly to a base model, but at least with 1 month ahead, this combination, these models that have a combination of indicators all perform fairly similarly across different countries. So even an AR1 seasonal model performs well, but you can see that there are other models that perform at a similar forecasting skill. This changes, that's just showing that in this highlighted figure here. This changes a bit when we look at 6 months ahead. So the 6 months ahead surprisals are now shown in these red dots, and this dotted line is showing the surprisal estimate for our reference model. And we can see there's quite a shift in the surprisal estimates across all models as they all become generally worse, or at least closer to our reference model when we're trying to forecast out 6 months ahead. But that you see this interesting consistency across most of these countries, where we do see that at least an AR1 seasonal model still continues to have improved forecasting skill, even after we're accounting for effects like differences in the length of modeling data available, differences across different countries, and also seeing that at least an AR1 seasonal model performs well, but also an AR seasonal regional model and an AR seasonal El Nino model perform nearly as well. And that is useful in at least indicating that, knowing some information about what's happening across the region could be a useful indicator for forecasting, but also that El Nino index, the El Nino index variable is also really useful in terms of potentially identifying a driver of regional dynamics. So in summary, we've really aimed to evaluate these forecasts at the national and regional level, and found generally, as you would expect, that forecasting skill tends to decrease as horizon time increases. We found that, if you're hoping to build a forecasting model at the region, or even just for a particular country, that kind of a good starting model might be the AR1 seasonal model. It tended to be consistently, tended to have better forecasting skill across different horizon times and across different countries. And that after accounting for some of these factors that we thought would influence forecasting skill, we've identified potentially 2 additional indicators that are useful when used in combination with a seasonality factor and an AR1 factor, showing that information about dengue at the regional level and kind of 6 month ahead or changes in El Nino are also informative for forecasting models in the Americas. And for some of the limitations of this analysis, so we mostly focused on looking at dengue indicators and climatic indicators. So we didn't really incorporate indicators like changes in mobility, aspects of immunity, or serotypes. For some of those things, the data it's not clear kind of which data we would use for that, given we're trying to use a lot of historical data. So for mobility, that might be a little harder to incorporate, but would probably be really useful for future dengue forecasts. And for the next steps in this analysis is we're working with collaborators from CDC to develop some similar models using a random forest approach to hopefully validate the model skill, the model forecasting skill, and see if we can find similar models using this approach that we found using my forecasting approach, and began to start to dive into some of the temporal forecasts, just given the volume of that data available, but trying to think about, in metrics like how well do these forecasts perform in determining the start of the season, the peak timing of these epidemics, and also the peak number of cases. And I would just like to thank all of the collaborators involved in this study, and really the collaborators who helped to provide us with a lot of this dengue surveillance data. It involved a lot of local governmental individuals, and also important collaborators from academia. And so with that, thank you for your time, and I'm happy to answer any questions you might have.
Thank you, Dr. Quandelacy. Nice talk. I'd like to open it up now for questions. You can either raise your hand or type something directly into the Q&A box, and I will read it out if the questions arrive that way. We have one question here, which I'm just going to paraphrase. but basically the question gets to the changes in the population of the hosts and their behavior patterns over time. Are there changes there that could be incorporated into a model, and have you given any thought to what that might look like, or even how that might be measured?
Yeah, so we didn't incorporate a lot of the aspects of the vector, and that is something we probably are really missing in that analysis. And I think we tried to keep the prediction model relatively simple in terms of implementation to be able to hand it over to different ministries of health if they had any interest in using this type of a model. So for those purposes, no, we didn't consider aspects of the vector.
Is that something that there's a reasonably decent path to measure that if you wanted to?
I know there's a lot of gridded data sets available that have some, kind of probabilistic estimates of vectors. And, we probably can look at that, maybe not in this particular forecasting analysis, but that probably is something that's worth evaluating a little bit more.
Okay, another question here. Can you tell us a bit more about the AR1 Signal Model and what you think allowed it to perform better?
Yeah, so I think, it's using information from dengue cases in the month before. And even though you would think temperature might be kind of a good predictor, I think a lot of the seasonal, just the seasonal indicator seems to capture a lot of that kind of variability that you might see with temperature or other indicators that might have more seasonal fluctuations. And so I think that's partly the information from dengue plus kind of what might be captured easily with the seasonality term that you might already see in other measures, but easier to collect seems to be what helped to perform a little better.
Okay, great. Here's a question. I missed whether you have data for the COVID-19 period 20 to 21 and whether you see any changes due to the population behavior in the same way we see changes for activity or for directly transmitted diseases.
I would love to get some more updated data. We don't have any data from 2020 to 2021. I think we have maybe 1 or 2 locations with data up to 2019. So we don't have that available, but at least we did a similar analysis looking at the impact of COVID in Puerto Rico on other respiratory viruses and dengue, but did also see that dengue dropped fairly substantially during this period.
Mm-hmm. Yeah. Okay. Here's one from our old friend Wilbert. How much do you think the rather unspecific multi-annual patterns and some lack of model performance is due to data quality issues, e.g. conflation of different illnesses of passive surveillance versus real heterogeneity in the epidemiology dynamics between locations?
Let's see. I mean, it probably did have a bit of we didn't account for any types of differences in reporting rates. I think at least for us, a lot of the data ended in 2015. So we don't necessarily have to worry too much about kind of capturing more Zika cases that were, misclassified as dengue for most of those areas. But if we do get updated data, that would be an issue and probably something that we'll need to address a little bit more.
Mm-hmm. Mm-hmm. Okay, another question here. Great talk. I wonder, did you consider the predictor importance in the forecast model? I guess looking at the coefficients of your regressions, can you rank the contribution of each predictor?
We didn't do that for this particular analysis, but that is actually what we're trying to evaluate with the random forest analysis too. So trying to look at the relative importance. So hopefully we'll have something more on that with that particular analysis.
Okay, another question here. Can you elaborate a bit on how you obtain the data and discuss any limitations in data availability?
Yeah, so we really, this was done or started when I was doing my postdoc at CDC. So we at least were able to engage with a number of people from ministries of health and asked to have like a data sharing agreement with them to collect their historical data. And so a lot of this data isn't publicly available. So there are probably some limitations in terms of the data availability, though I think when we get to publishing this, I think that's a conversation we'll have with those particular countries, given that that is their data, and they provided it to us to be able to evaluate it for their particular countries, as well as looking at it for the region. So I think it's more kind of important to engage with them and how they want to handle the data sharing, and do that in a way that's respectful of what they would like as well.
Great, thank you. I'm not seeing any other questions, so I'll throw out a couple that came to mind. I'm curious about getting into a little bit more, some of the more detail about the geographic variations, and wondering if there's any possibility of adding either some population density data, for example, about which urban versus rural areas, or perhaps more fine-grained climate data that might go beyond just sort of the rainfall and the El Nino, but also looking at the types of regions you're looking at, coastal versus inland versus mountainous versus lower, things like that.
Yeah, so that's a part of a different analysis that I didn't actually present here, but we do look at population density, and at least for each location, trying to get some estimate of urban versus rural, proportions, and see how much that does impact at least the seasonal and long-term, dynamics. And we do find that those play an important role. I think one of the challenges in using finer scale or gridded data sets is that at some point we still have to aggregate upwards in some ways, because we only have subnational data. And we did use gridded data sets to collect our temperature data, but we are still kind of limited by that geographic scale, but would love to be able to look at that a bit more. But we are looking at kind of variations in region and some of the differences that we might see ecologically for different time presentations.
Great. All right, here's a question from Jamie Caldwell. Given the usefulness of cases in the month before, would it be possible to create operational forecasts? For instance, are surveillance systems well set up to produce and share QA, QC cases on an ongoing basis?
Yeah, so that's kind of what, excuse me, the basis of this analysis was for. I'm going to take some water. Was to kind of try to develop some of these models, and we are working with kind of PAHO to host meetings to talk to or to see what needs there are in terms of prediction and surveillance for different ministries of health, and trying to see how some of these models can be more systematically built and at least used as a more routine part of surveillance.
Okay, I have another question here, but before I do that, I want to just point out that in the chat, Michael Ben-Nun posted a link to a recent paper from the Lancet that talks about the drop-off in dengue and the effects of COVID that might have been related. Another question here, were you able to do statistical testing of synchrony between wave patterns across locations and between dengue and climate variables, such as correlation of wave transform across wavelet tests? Any prospective tests for traveling waves?
So, so we did do that. It's part of a different analysis that I didn't present the results on here, but we have looked at, kind of a phase analysis and looked at some of these correlations across the region, and still kind of in the process of finalizing that analysis, but that is definitely something we're looking at right now.
Okay, great. Any further questions? Well, I have one question here that asks if the AR1s are similar to Markov chain models, the stochastic models.
So at least for this, we're just calling the AR1 as a lagged term of the monthly time series of dengue. So fairly simple in terms of the indicator used, but yeah, no kind of stochasticity involved with that.
Okay, great. Thank you. Any final questions? Really appreciate the great engagement. Here's one more. have you thought, since you have so many locations, have you thought about the best spatial skill for forecasts?
So we did all of these forecasts at the subnational level. Just given the volume of the data at this point, we are focused on looking kind of at regional patterns and patterns across different countries. But I think right now we're trying to figure out a reasonable approach to be able to look at the specific subnational locations, given that there still can be quite a bit of heterogeneity within country. And we do see that when we look at the subnational level.
Okay, great.
Yeah.
And here's another question, looking for more details about the wavelet analysis. In particular, how to use the wavelet coefficients to describe the seasonal variation of dengue in the first few slides.
That's probably going to go into a little bit more detail than we have time for now, but I'd be happy to chat with him offline if you'd want to hear more about it.
Okay, great. Yeah, understood.
Yeah.
Okay. I think unless anybody else has any further questions, I think we're good for now. I'd like to thank you, Dr. Quandelacy, for your very interesting talk, and thank all of our attendees for joining in. This will be posted soon on the MIDAS website, YouTube site, excuse me. So if you can check into it there and contact Dr. Quandelacy directly if you've got any further questions you want to engage. So thank you again.
Thanks for having me.
Okay, take care.